Welcome to the Lift and Make Lighter podcast. I'm Tom Telford. I am here in Riverwoods Behavioral Health with Dr. Trish Barrus, who runs Riverwoods Behavioral Health as the owner, founder,
Right.
and
clinical director.
Thank you for having us.
Oh, my pleasure.
Awesome to be with you. Let's start off. I'm intrigued to know your background because where we are today, talking through your clinical experience and all that you're doing to impact positively the lives of the clients who come here, it started somewhere. So take us back to the beginning. Tell us about you, your family, your professional background, and why you chose this profession.
You know, growing up, my father had polio. He was actually the last person in the state of Utah to get polio before the vaccine came out.
Wow.
And it completely paralyzed him for the rest of his life. I was 2 years old. And just living with a disabled parent and wanting him to walk and wanting him to do things with me, it was really, just extremely powerful for me. And so growing up, I always was just looking to others and how can I help them? And in my heart, just softened because of his issues. But the one thing that he taught me was don't ever complain. And I never heard him complain once about his situation. Wow. And so that kind of, I grew up like that. And so I teach positive psychology at the University of Utah. And so that goes right along with the things.
You're a professor too?
Yes, I'm a professor.
How many courses at the U?
I teach 4.
Wow. How do you get it all in?
You know what?
You don't complain.
No, you don't complain. It's positive, right?
Yeah.
But it's teaching is different from clinical work. And so it uplifts me a lot. And where clinical work can get a little bit, draining.
Yeah, we'll talk about that.
Yeah.
Not easy.
Yeah. And so that's where I got in. I had a teacher when I was in high school, my psychology teacher. It just fascinated me about the brain and how it works and things like that. So then I majored in psychology. And it was great. And like I said, teaching 4 courses, the U in positive psychology, but having a clinic that we really focus on positive psychology. And I just think we focus too much on what's wrong in life instead of what's right.
Yeah. So many questions to ask you about positive psychology. I'm a huge fan, of positivity myself. I also have had a family history and my own health challenges, so I faced it. How, in your childhood, when you look back and you think through your mindset now, was it seeing your father that created this mindset of compassion? Is the core a compassionate heart there before you chose, to go that route and wanting to help and care for others?
I think so. And then my mom. My mom is a 22-year-old woman with 2 children and a husband who can't walk or take care of himself. He became an engineer. In those days, it was very, very, there was a lot of prejudice. And so he had a hard time getting a job, but he did, and his mind was never hurt by the polio. It was just, he was brilliant. But yes, I think that's where I learned it from. We do. Growing up, we get these schemas in our brain where these thought patterns, right, about how life is, and that's where it comes from. Yeah.
How was that growing up in a household, watching your mom provide in that way? Meaning, you probably viewed being a woman and having not just the traditional run the household, but was she also working as you grew up?
Yeah, she worked. And so I saw that side, even before women were working more, right, out of the home. And she was a school teacher, she was an educator, and then she became a counselor. Wow. And so, I watched that too, and the things that she did to help people, and just, she was a very, very strong woman. Yeah, and my husband would say, yeah, she's strong, just like you.
Oh, strong in opinion.
Yeah,
I think you'd have to be, right? I
Mm-hmm.
mean, you can't be strong to survive in the world and not also have some of the byproducts of being strong in the world.
Right,
You know,
right.
that strength, that inner strength that you saw your mom have, it now makes sense to me, even seeing and hearing how you do what you do.
Mm-hmm.
You know, your energy for running a practice, founding a practice, and also being a professor of 4 classes. And
Mm-hmm.
you also sit on a committee that shapes a lot
Mm-hmm.
of what's going on legislatively in the state of Utah. Comment on that just a little bit, just so our listeners know that committee and what it does and its purpose.
I sit on the Digital Health Services Committee for the state of Utah, and we are just doing things trying to get people so they're collaborating and different doctors' offices, hospitals, therapists, and all everybody so
Yeah.
that we're collaborating more, which we need to do, right?
Yep.
And so, and we're just trying to figure out how we can promote that interoperability and some of these things. I'm not a great techie, so I don't, you know.
It's all good.
I can talk about the mental health part and, you know, and what,
Yeah.
how to get that out there a little bit more and soften the stigma.
Right.
Soften the stigma, right, of mental health. Yeah.
Yeah. When you think through what you're involved in now and what you're, doing clinically, how did it begin in terms of just providing therapy or being a psychologist, practicing in mental health, and how it evolved from maybe traditional mental health, the way that it was practiced, to today you're involved in a very forward-thinking approach to mental health and even doing, psychotherapy assisted ketamine support. So talk through that evolution, how you began and where you've evolved.
I've been doing this for 25 years now as a therapist, and we all see successes and we see things that aren't so successful. And I've had people come in and say, you know what? If this is just going to be talk therapy, it doesn't work for me, and so they leave,
Yeah.
or they're not engaged in the therapy part. And so I knew, that some of the things that are going on right now, I think mental health in the next few years is going to change. Mental health treatment is going to change in the next few years because just SSRIs don't work for some people.
Yeah.
Other things don't work for some people. And so I got involved 9 years ago with a functional medicine doctor. And we decided to do ketamine with his pain patients, his autoimmune patients, his Lyme disease patients. And we realized then that, boy, it's a lot better for not only pain, but depression, anxiety, PTSD, and some of those mental health issues
Yeah.
that people have. And so that's where that became. And then we integrated into this practice here. And I have seen so much success with people who are especially treatment resistant to anything else that it's quite amazing. And I just wish people knew more about it. And I wish there wasn't a stigma about, taking medications and things like that. Because I see ketamine as a medication, basically, not a drug. It is a drug, but it is. We here in our clinic, we're very, very careful to make sure that it's medically given and that it is useful for the person and not just we're going to get them high.
Yeah.
Right?
Yeah, absolutely. How it's done is an entirely different, question there. And so you mentioned just a minute ago, you mentioned SSRIs. So will you just describe what SSRIs are, what their role in the mental health industry is, and how they compare to what ketamine is and what it's, used for in the mental health space?
Well, SSRIs are things that, they're reuptake, so that in the brain they're just making sure that some of the negativity and things like that aren't going into the brain or affecting people. SSRIs are things like Prozac and why am I going brain dead now?
Yeah, medication for our
Yes,
listeners.
yes,
An SSRI
yes.
is a type of medication. It's typically prescribed by
The
healthcare
doctor.
professional. Levo
Yes.
prescribes
Yes.
SSRIs. And
Yes.
so for certain,
Zoloft,
yep,
different things like that are Prestige, some of those other things that
Yeah.
are, useful. And, again, they have their place. Doctors for years have been prescribing them. Ketamine is hallucinogen, and and people will have a trip on ketamine. You don't do that with SSRIs, right?
Yeah.
And the problem that people just really don't like about SSRIs is they kind of flatline you, and so your personality just doesn't come out. And they make some people tired, and they make some people so that they are not motivated.
Right.
And so that's been hard for people.
Yeah.
But ketamine, being a hallucinogen, affects the neural pathways in the brain. And so that people, we all have schemas from times we were young, that, thought processes that go, that help us to live our lives in a certain way. And there are belief systems. And ketamine changes those belief systems very, very quickly, especially if they're very negative. And you can literally see the structure. I have a therapist who works with us, and she and her husband were working at Yale in the VA years ago, and they did a study on ketamine with 2,000 participants. So it wasn't just, 10 people, right?
Yeah, a few people.
Right. And they watched with functional MRIs while people were being administered ketamine and what was happening in the brain. And they said you could literally see the structure of the brain change.
Wow. We need to talk more about this.
Yes.
This very thing, because when people start their mental health journey and they get into, I'm going to call it some of the traditional ways and paths of going through the mental health journey. You may start in therapy. You may start with your primary care. You may start at a pediatrician. You may start in these, traditional forms of healthcare, trying to receive mental health care.
Right.
And depending on their background and specialty, that may work. But for many people, the journey tends to start with some sort of therapy, potentially medication. Where would individuals potentially move on from those traditional sources to look at alternative sources, such as therapy-assisted ketamine, and you mentioned a term there, which I want you to just describe to listeners a little further, which is treatment resistant, because it's often written about or discussed, but what does it mean to people who are struggling with their own mental health journey and saying, it's not working for me, Talk about that.
I think, again, we're a society where we want to take a pill. And we want it to fix us just like that.
Yep.
And I would say most people's journey with mental health starts with their primary care physician, even before therapy, because therapy has a stigma. Oh, you're in therapy?
Yeah.
However, there's a little trend. Oh, it's cool now that they have your therapist.
It's getting
right?
better.
Yeah, it's getting better. But I think, again, when and medications, especially SSRIs, take, 6 weeks to kind of kick in. And so some people, when they're really suffering, they don't have 6 weeks.
Yeah.
I mean, it's really hard for them to wait for 6 weeks.
Sure.
And then is that really what's helping me? Is it that, or is it because I got a dog, or is it because, I changed jobs or whatever? So you really don't know what's happening in those 6 weeks. And so I think people just get really frustrated. And then if that doesn't work, then they're tried another medication. And that takes 6 weeks. And so I think people just get really, really frustrated with that. Ketamine works really quickly. It's a 4 to 6 sessions and can change you around in several weeks.
Yeah.
And so, and people who, especially when they get so down that they become suicidal, that you don't have a lot of time with a suicidal patient. I mean, I've been told, if this doesn't work, I'm going to kill myself. And so that's a lot of pressure on a therapist.
It's a lot of pressure.
Yeah.
Yeah.
And so we look for things. In ketamine, I've never seen anything that works like that.
Yeah.
Getting people around.
It's interesting how often, working in the mental health space, I'm also married to a therapist. It's interesting how often I hear the term exhaustion. I'm just so tired of trying to find a solution and trying to feel better. And to your point, a lot of the traditional sources take time. You know, we tell people at Leva when they come see us, you know, this is going to take some time. You know, there is no silver bullet. It's not going to be quick. When you think through the reaction that many have coming to receive, you know, therapy-assisted ketamine, do they tend to see some of the fruits of it, the positive fruits of it immediately, meaning day one? I mean, you mentioned 4 to 6 sessions is typical. Can they see some of that soon?
You know, ketamine purges you, or you purge through ketamine. I mean, it opens up the conduits to emotions, but it takes some time, especially in people who have really a lot of trauma, PTSD. So it takes a little bit of time. I always tell people, wait, just hang in there with me.
Yeah.
Because the first 2 sessions, a lot of times are somewhat dark, and you're purging, and you don't even know what you're purging. And the interesting thing with ketamine, as opposed to regular talk therapy, I mean, you're going through with talk therapy, what happened, and going through all the negative things, the abuse, and how that affected people, or whatever it is that you're dealing with. In ketamine, you don't do that. It just is gone. And it sounds really weird. I know that sounds weird for something just to be gone, but it is. They don't have to go through all the trauma and everything. But it takes 2 to 3 sessions. And it's kind of like peeling back the onion, right? That a little you work on something, and then something else exposes itself.
Sure.
And so then you just have to work with it. But I have some really poignant people and stories that who have, when we talk about treatment resistant, that nothing else has ever worked for them, whether it's different types, modalities of treatment, or if it's ECT, or if it's different things. I mean, TMS now, some people do that, and nothing's worked for them. And so it's so gratifying to see this. But, you know, it's really frustrating too. We had this one patient of ours come in, and he was blind, and he shot his eyes out. He tried to kill himself, and then it was worse because now he's blind. And we worked with him after that fact, trying to get him. Of course, he was so suicidal, and now he's even worse suicidal, right? And we did ketamine with him, and he said, "Oh, dang, I should have come here first before I did this." But the ketamine now has just switched him around to where he's happy.
It's incredible.
Happy.
The outcomes that you hear for this type of an impact, you know, in my mind, because being married to a therapist and being in the industry so long, it makes sense to me why it takes so much time. People spend years and years getting into the mindset and the position they are. It takes a long time to unwind some of that. And so it makes sense. And so when you hear some of the outcomes that ketamine can have in such dramatic fashion, the skepticism meter for me goes up. But I've now read enough in studies. I've talked to several people, especially you who are doing it right, a trusted source, a doctor, you know, who's doing it in the right environment, in the right setting with the right professionals, you know, at your client's side. You're doing it right. But still, people, especially those who have been in pain, mental pain for so long, it's hard to believe that it can work. So can we double click on it just a little bit and know a little bit more? You talked about that is literally rerouting or changing neural pathways. How does a hallucinogen actually do that? What's the science, if you don't mind, the psychology of how it works?
You know what? I don't know that we know that completely, why it's
Fair.
working.
That's
all
fair.
right?
Sure.
I mean, we know what part of the brain it's working with, the emotional part of the brain, the amygdala. And what I think, too, is it helps people give some clarity of thought where they may have a lot of misconceptions. They may have some brain fog going on. And I think it helps open up the prefrontal cortex, which is the logical reasoning part of the brain, to where they're thinking about it. But then you're also feeling. I mean, people who do ketamine, they get very emotional, and they don't even know why they're emotional. And so, you know, I don't know that we really know the mechanism yet.
We just know that, I mean, literally, you talked about it. In live brain scans, it's showing that it's altering something.
The structure of the brain.
Yeah.
Yeah. And so I think it gives people the opportunity to see different things, possibilities and opportunities that they have in their life instead of staying stuck where they're stuck. It's just an interesting thing because you can work with someone for so long and they're done. I mean, it hasn't changed them that much. But when you're changing the structure of the brain, it's going to change people's perception of themselves, and that's what it does. It changes the perception.
Take us into a session.
Okay.
So set up the room, even before they're in there. I know that you have a very in-depth intake process analysis. Again, you're doing it the right way, which is why I wanted to be here and talk to you and your team about this. So take us through the process. When someone calls and says, I need help,
okay,
where do they go?
And let me just say, yes, the right way is really important. I've been doing it with 9 years with some of my therapists, and so we're not afraid to look at things and maybe we can do it a better way. So we're constantly looking for different ways and different things to do. But if someone calls, we do an assessment with them first of all, and I do the assessments to make sure that ketamine is really going to help them. Or if they have issues like hormone problems or different things that they need to correct before, we always recommend that they have a good physical before they come in and start the ketamine because, again, I had a patient of mine that he had way low testosterone, and he didn't know it. And I said, this is not going to work. If there's anything wrong that is chemically wrong with you, it's not going to be as effective.
Sure.
So he went to the VA. He was a vet, went to the VA, and they found he had really low testosterone. So he got that all taken care of, which causes anxiety, a lot of anxiety. So that was a lot of his problem, but he got that taken care of. And then he came in, and then we did ketamine with him. But so we do that. We do an assessment, make sure that this is, you've tried other things that may have been just as effective for you. And so then I assign him to one of our therapists. We have 4 therapists here that do ketamine and assign them. And then they come in, and I tell them to come in with an intention of what they want to change. And so some people, especially those who have had abuse or trauma really bad in their lives, they may not want to even face it yet. So we don't have to go through it all, but come in for intention. Well, how is that affecting you? I'd like to be more confident in my life. I'd like to realize I'm more capable, and so that we talk about that, and then the therapist will take them in, and they're out for about 40 minutes. And the therapist's role is, and we have a nurse practitioner and a therapist who is in the room with the person the whole time, and so they're doing more meditation with them, talking about the things that we had talked about initially about the intention, and they're talking about them. Some people talk during the session, but a lot of people are out. We have them record their session, so if they don't remember it, that they can remember it because they're listening to it. And that recording actually becomes more of a meditation for them. And I'll have people come up to me and say, hey, I'm still listening to my meditations. And it was 5 years ago I gave it to them because they say every time I listen to it, it kind of brings me back there, and I have the same feelings and things like that.
Wow.
And so they're under for 40 minutes, and then it takes them
when you say a little bit more about that, when they're under. So, I mean, I'm picturing them being out like they're, going for surgery, but are they out?
We give IV, and that's something different that we do too. We do it through IVs, not just a shot. The IV works a lot faster, and it's much more effective, we feel, because it's much more powerful than maybe a shot is. And so we give them ID based on their weight. We microdose it according to their weight. And so the nurse is in there. She will hook them up to an IV. Then she gives them, a push. We call them a push into the, bloodstream, into the, the apparatus that we have. And they're out. Now, some people go out deeper than others. I mean, it's not as deep as when you have surgery or something like that, right? But they're out. They're not in the room. We say, if you in the room, can you feel your surroundings and everything?
Sure.
And so that's where it is. But some people don't. Some people's metabolism doesn't lead them to go out a lot. But they're still in an altered state where they can, they're much more open. They're much more open to talk to the therapist and that sort of thing. So it just depends on the person.
Sure. How much does someone's inhibitions or willingness to kind of let go of control? Control is an interesting thing when you get into mental health.
Yeah.
That one of the challenges that people have with anxiety or depression or some of these mental health issues that they're facing is that they literally hunger for control in their lives, whether it was trauma that was, taken from them, something is they're hungering for control. And so how important is that kind of loss of inhibition or control part of the process that they're going through?
This is one of the things that we work with them on. You're going to feel like you're losing control. But the more you just relax and let your brain take over, your subconscious brain, I mean, that's what we believe is happening. We're talking to their subconscious brain. Mm-hmm. And so they may not even know things are bothering them or what's bothering them, right? And so it's especially with women. I don't know. We want to be in control a little bit more, I guess, but it can get kind of scary for them the first couple of times that they realize. But you really are in control. I mean, if you were really too scared or whatever, you come out.
Yeah.
Yeah. And if something happens, we just turn the IV off and you're right back in the room.
Yeah, sure.
So
are they sitting down? Are they laying down? How are they?
They're in a recliner.
Okay.
In a recliner chair, and the therapist is right next to them. Something else that we have found is that because people do feel, some people say, I had an experience like I was in the Matrix. Some people say, I had an experience like I'm in Star Wars. And then other people just see geometric shapes, right?
Yeah.
But what we found, it was a little frightening when I started doing this. Most people I had noticed they were frightened a little bit because especially if people haven't ever done drugs, they've never done alcohol and stuff like that, so they've always been in control of their mind, right? And so we found that if you just hold the person just right here on their arm, it grounds them. And they can feel like you are there with them, and so it doesn't scare them as much. And then when we did some research, we found out there's a nerve that goes up your arm into your head. So anytime you're in a fight with someone, just go like this and hold their arm. And they'll calm right down.
Sure. So is that the role of the therapist in the room? They're there to keep them feeling safe. Mm-hmm. Does the client going into the actual ketamine session, are they meeting with that therapist and building that relationship prior to that session occurring? Is there a relational connection there?
That is so interesting because usually it might be the first time they've met the therapist, the first time they do it, but the bond is immediate. I used to work as a clinical director of a recovery center, and the first thing we did with them was did ketamine with them on day one. Because they bonded, I don't know why, but they bond immediately with their therapist and they trust them. And so after one time doing it, they're there with the therapist.
There's a connection there.
There's a real
I've heard that from my own family members that the experience they had with the individual in the room was incredible. Mm-hmm. And so what is it about that? Because I'm curious. They're in this, altered state that's helping them kind of release maybe some of the mental mindsets and challenges or trauma that they've dealt with in the past. But what is it about the bond and the connection there? Because there are organizations who will provide ketamine, even through the mail now, where people are receiving it or they're going to a pay cash clinic and they're in and out quickly. And in those situations, it seems like that is not creating a safe environment to make an impact. Does that make sense? It's just how you're doing it right is going to change the effectiveness for the individual.
The research isn't very keeping up with what's going on here, but I really do believe, and I'd say a fourth of our clientele that come in have done it someplace else, and they didn't bond because they were given a shot and left in a room. There may be several other people in the room with them that are having an experience, and it's just weird for them. But they don't bond, and it scares them. It scares them. Just, I think, again, with your hand on their arm and being able to talk, they can hear your voice and everything, so they know I'm free to have this experience in my mind because someone is there in the room with me.
Sure.
And I just don't think the other ways are very useful or beneficial. I think maybe, again, ketamine changes a little bit, but I think, again, when you have a trusted relationship, and that's what therapy is, period, is if you have this alliance and this trusting relationship with someone, then you can open up to them. If you don't trust them, you're not going to open up to them.
Sure.
And so the safety issue is really important because then it lets them cry. I mean, people will say to me, "Am I crying? Or did I cry?" And they were. Or else they'll say, "Did you notice me crying?" And I'll say, "I didn't." "Well, I was crying inside." And so it just opens that up to where they can have this experience that is changing them.
Sure.
Yeah.
You mentioned intention, that they have an intention. Why is that part of the therapeutic process?
Because you don't want to tell people what they want to think. I mean, probably one of the criticisms is that the therapist is programming them or telling them what to think, or it's all about the therapist. And so you want to tell them their intent, have them decide what their intention is, so that the therapist then can, okay, that's what they want to work on, that's what we're going to work on here.
Sure.
Not what I want them to work on, but what they want to work on.
Yeah, it seems like that can be a difference maker, so that, and I'm just trying to picture someone who's going into the ketamine clinic on State Street versus coming into a safe environment where someone is initiating safety with them, interacting with them, and spurring on this intention dialogue so that they are working on something that can help them,
Right.
alter an outcome. I mean, the goal of ketamine is to have something change in their lives.
Right.
Tell us more about that. What are the outcomes that you're seeing, the experiences where you have said as an organization at Riverwoods Behavioral, hey, we're going to go further into this? It's having such a positive impact. What got you to that point?
Well, again, it's being able to see something that works quickly. A lot of people need something they haven't had. They're just frustrated because nothing has ever worked for them. But we've had people. I had one of my patients that he had a heart attack. He almost drowned. He fell off a boat. He had a heart attack in the water. He did not have a life jacket on, and no one was around. And he's in the middle of this lake, and someone just happened to come by and pick him up, and they life-flighted him out. He lived. But then he has this panic. Then he has this PTSD and this trauma that he's constantly having. And he's from Hawaii, and he can't even go home because it's water all over, and he can't handle to be around water and things like that. We worked with him with 4 to 6 sessions, and he went to Hawaii. He went to all the the places that he has gone before, and was able to go back to that lake again. We had a young man who was in Colombia, and he was kidnapped. And so he came and, was let free, and he came. And, of course, he's having all these nightmares and all this stuff happening to him and not trusting everything. And we were able to work with him, and he went back to Colombia.
Wow.
And he was okay. And so, again, it's just changing. And I've seen people who have severe trauma, ritualistic abuse type things from the time they were a child, and it is even affecting their mental health, or not just their mental health, but their physical health too. Terrible headaches, terrible things like that. And you talk about it, and everybody says, "Oh, well, that sounds too much like a miracle here or something, and we're not buying this." And so when people will come in, I'll say, "It's a miracle, but it's not a miracle. Okay, you got to work with it, because if you have people come in and they're resistant towards it, it's not going to work as well." And so if they I'm just the way I am and nothing can change me and stuff
Sure.
like that. It's not going to help them as much. We have them also go back after their treatments and tell them to write and so that they can see the change. And it may not be this huge change right at the beginning, but it does. And it does maybe through several weeks. And so if they write, they can see the change that's happening in them.
I love that exercise, just going back and journaling and the ability to kind of rewrite the story, so to speak,
Right.
seeing that difference.
And we will have people too that come back. Maybe they've done their 4 to 6 sessions, and I have several that have bipolar, and the guy said, well, if this doesn't work, he says, I don't know. I don't know if I want to live anymore because I am so angry with my family all the time, with the mood swings with bipolar.
Yeah.
And the initial 4 to 6 session worked really well with him, but he'll come back like every couple of months just for a refresher.
Yeah.
And then he's fine and he leaves again.
Yeah. Is that a normal session the same in IV, or is there alternative ways also that you can, I guess, do maintenance doses for people? Is it just IV, or are there other ways to do that?
That was something that we started experimenting with last year because ketamine comes in troches or lozenges. You put them under your tongue too. So we started thinking, okay, if people completely aren't, like they may have still a residual feeling of depression or anxiety or something like that, we give them these troches that they can take home. If they've had a good experience with the IV ketamine and it hasn't affected them in an adverse way, they can take these troches home. And of course, our nurse practitioner is really, really strict about it. How many, your prescription says 1 to twice a week, and that's all you take. And a lot of times, it just helps them just get that feeling of comfort or just calm feeling that just helps them stay in that state where they feel like they're progressing.
Yeah. It's great. It's interesting to kind of hear, the process and the maintenance side of it, because I would imagine for a lot of people, even though they get past maybe the initial trauma, there's so many things that take people back to the trauma. You mentioned the gentleman and his family. There's so much about our lives, in our surroundings that keep us kind of in that state, of mind. One of those things that keeps us in that state of mind, or that the way that we think about things, is our faith or religion, or that connection, that we have, the way that we live our lives. Being in Utah, large LDS population, you mentioned if they've never done drinking, or if they've never, done drugs before, that is a component of being LDS, this health code. I've heard several people now, just talking with even my own family members, they haven't wanted to do, we use the word do like it's a drug, like do ketamine, when in reality, ketamine is a type of medication for a purpose. So will you share just a little bit about that, how some people may struggle with the stigma associated with ketamine treatment because they feel like, you use the word hallucinogen, right? So immediately my mindset goes to, well, there's going to be a certain population who needs help big time, but they view a hallucinogen like LSD or shrooms or smoking weed, whatever that is, right? There's a street kind of connotation to doing ketamine. Talk about that. The stigma, where it's a challenge.
But I think we have to be open to it as a medicine. And even in the next couple of years, I think even shrooms, mushrooms, and MDMA and some of those things, if it's being used medicinally with a doctor, I think that's different than getting it off the street, right?
Absolutely.
And so I think sometimes we have to look at it, that there's going to be other medicines that are developed in the near future or things like that. And this is just being shown, it's already out there, and it's being shown to be useful for mental health a lot.
Yeah.
And so I think we just have to change our mindset that it's not a drug, it's a drug, but it's a medicine as well. It's going to help us. And, one funny thing is I had a young man, not too young, but middle-aged man come in, and he said, yeah, I was so depressed, and my father-in-law, who had been a mission president, all these things, he says, you need to go try ketamine. And he says, my father-in-law is getting me addicted on ketamine or something. He was just thinking that was pretty funny that his father-in-law, who was a straight person, was telling him to go do a drug. But we have to not look at it like that.
Sure.
It's not just to get high. And that's what worries me about some of these places that just give you a shot. And I mean, it's kind of I don't know what we'd call it, but it's just allowing them to, get high. And
Pay to
not,
get high.
it's not medicinal. It's just
Sure.
yeah.
That was one of the reasons that I was attracted to collaborating with Riverwoods, because doing it the right way in the right setting creates an entirely different experience and context, to it. And, regarding the stigma associated with it, in Utah, we hear almost every day about good people who become addicted to opiates.
Oh, yeah.
Good people who have poor coping with whatever. It could be eating 20 cookies from Swig, but they would never do ketamine, but they'll be addicted to sugar or other things that are coping in life. But in reality, they're negative outcomes for them. When you think through some of the impacted stories, of people who have come here to receive ketamine, what does life look like after? Once they're through it. I mean, it's not like sunny, roses every day, but what are you seeing and hearing from people who have gone through the process and what their lives look like after?
It varies, but there's a sense of relief that finally I found something to help me. And to tell you the truth, we get a lot of word of mouth. We get a lot of families in here. I think one family, not just the nuclear family, but the extended family, out of all of them, I think there were like 6 that came through here because they were all having the same issue, the generational thing, going on there. And so they were having the same issues. And so they said, oh, it worked for him and her. Oh, well, it'll work for me too. And so I think when people, if we can let go, but therapy has had a stigma. I mean, to even go to therapy.
Sure.
So it's not just ketamine, it's therapy. But there must be something wrong with me if I have to go to therapy.
Sure.
And that's just not true. And
I love hearing those stories about 6 people in one family.
Yeah.
Right? Because when you really think through that, what you're saying is we're going to stop the generational trauma here.
Right.
We're gonna cut it off where, I'm married to a therapist, and so I know the family unit, and I know how much trauma gets passed to the next until someone says no more.
Right.
And are willing to just say, I mentioned this earlier, but at some point you kind of have to put your foot down and say, I don't care about being tough anymore. I don't care about the stigmas of like weakness or whatever. I just have to stop it, And so I think that it's commendable, for people who are willing to just say, I'm going to address this.
Yeah. And it shows us that it's working. I mean, the greatest sense of gratification that I have is when someone comes in and says, oh, my neighbor, it just changed their life, and I need something to change my life. And so, again, word of mouth, and it's working.
Yeah. Yes. Story. People's lives that are changing.
Mm-hmm.
Tell us more about where you see the industry going. Is there some foresight, in your leader mind where you're thinking, where is this now and where does it go in the future?
Well, I think, again, a lot of disinformation about ketamine and you'll hear, the Matthew Perry story where he died of ketamine and stuff. He really didn't die of ketamine. He died of drowning, but he was too out of it to even realize that was going to affect him like that. Yeah. And so we've got to get more good information out there that this isn't just a high, that we are going to, change your brain, help you change your brain, help you change your life and that sort of thing. And if we can get that out there and, it's convincing the insurance companies to pay for it. Sometimes I think they don't want to pay for things that work. And so it's
Go figure. Healthy people's not really a good long-term business model.
That's right.
Yeah.
And so if we can get insurance companies, because it's expensive. And some people will go into, these other give a shot, and it is cheaper. It is cheaper to do it that way, but it's not as effective, and you're not going to feel as safe and everything. And so it's getting it so that it's affordable for people, is where I think it's got to go. And then there's going to be other things too, like I talked about shrooms and things like that. In the near future, the FDA is looking at all that stuff now.
Yeah.
There's been a lot of study. We have a therapist that works for us. It's right at the head of that, of the psychedelic movement. I mean, she's been to the White House. She's doing studies on it, and they're finding that it is helping people who weren't able to be helped by other things.
Yeah, fascinating, where it's all going. One of the things that intrigued me about our first discussion when we visited was it was a unique combination to sit with someone who's so medically trained the way that you are as a doctor, but that you're also teaching as a professor positivity. Mm-hmm. How did you land on positivity? I mean, you mentioned a little bit about growing up, and you saw what was going on in your own household, but share more about just positive mental health and the implications of having a positive mindset.
My dissertation when I got my PhD was in gratitude. And
wow.
So then the department said, the happiness course at Harvard is the number one course in the country. And especially at Harvard, it's the number one course. And so we would really like to do an undergraduate certificate program in positive psych. And I had just done my dissertation. I was at the right place at the right time. They asked me to do it, and we created, myself and a colleague, created this course or this certificate program. It's got like 12 classes in it. You have to take so many of them. I teach 4 courses in it, and the thing is what I have seen with college students. I mean, especially with COVID and what happened with them, and that like their whole world was shattered, and they weren't able to graduate or walk for graduation. They weren't able to do their last year of a sport, and things like that. I mean, it just devastated them. Yeah. But what we found is one of my therapists is working up there, and she did her PhD, and she used my data. I have 15 years of data pre and post the class, and what she found was that if you take a positive psychology course, it's just as effective, if not more so, than one-to-one counseling for college students.
Wow.
That's huge.
Interesting.
Really huge.
Yeah.
Because
and you get credit.
Yes. And it's just fun for me to say, for the students to say, this is my most impactful course in college. Yeah. Because it changed the way I see myself. I helped me change. I teach coping with difficult people. The whole football team took it several years ago at the university.
Oh, I love it. So, and the coaches probably loved it.
Oh, and yes. And it's online. And so I have a lot of athletes take it because it's online. And, we laugh because a bunch of they were finals or when they're doing the bowl games for football. Yeah. And so I'm getting all these emails from, the football players. Could you give me a few more minutes and a few more days to
I'm
finish?
at the Rose Bowl.
Yeah.
I'm playing the Rose Bowl.
Exactly.
Come on.
Could you give me a few more days?
Oh, that's funny.
And, of course, everybody gets a few more days. And because you can't be preferential to the football player, but it's fun. It's fun. Yeah.
That's cool. I listened to a podcast the other day. A gentleman by the name of Rich Roll had on a psychologist and a doctor who basically coaches some of the most elite athletes on the planet. Mm-hmm. And he talked about the importance and the science behind happiness on performance. Mm. So share a little bit more about that. I mean, his basic, response in the podcast was, if there is a way that you can find gratitude and happiness in your training and performance, you literally have an advantage. So what is that?
I think it's just chemical. I think it's the endorphins go in, and if you're happy, you're going to be more, you're going to perform better. Which brings me to another story. We had, and this is actually a story, a study that we have submitted to Frontiers of Psychiatry and to be published. And this man came in for anxiety, severe anxiety. He was a CEO of a company, and every time things would happen, he'd just get this just terrible anxiety. And so we did ketamine with him, and on Thursday we did a ketamine session with him, and he ran a half marathon on Saturday, and he improved his time by 30 minutes. Now that's an outlier. We don't know why that happened, but yes.
I'm about to do a large mountain bike race, so I need an appointment the day before, apparently.
Well, and I said, why? And he said, when you're running, there's a point where you get a block. And he said, I never got a block. He says, I was just running just free for all, and it was great. But 30 minutes.
That's
30
incredible.
minutes. Yeah, it was amazing.
That's doping at a whole new level.
Yeah.
That's funny.
Yeah.
But it makes sense to me just in terms of, when you really dive into performance, and if you're stuck or if there is a block, golfers are great, about that, clear the mechanism. But there's something to performance in that, just being unblocked. And I can see where ketamine could be a role in that. So.
And where it really could help is with first responders who see trauma all the time, and it really affects them. And and I don't know the drug situation, if they can, if they see it as drugs or if it would help them. But we've had several first responders come in and was able to clear them, especially if it's a really traumatic thing with children or something like that. It's been able to clear them to where they've been able to go and even, perform their duties again.
It's amazing.
Yeah.
Freestyle a little bit.
Okay.
Having been in the industry for a long time, owner, you're a professor, you're in this, you're all in this. What are you seeing in society that you think, wow, this is a concern, or this is what I think about, or any things that just red flags that pop up?
We don't trust each other, for one, and we don't know what the truth is. And I think, again, we're losing our liberties. I think we're losing our freedoms in a lot of ways, and I think that people are afraid. I think, especially with the youth, you'll see teenagers who will say, I don't trust anyone. And in fact, they did a study several years ago with high schools out in Salt Lake, and they asked the students, what is your problem? What are the things that are really bothering you? And the number one thing is that we don't trust the adults in our life. If you don't trust, then how do you get help? And we have an epidemic of youth killing themselves and they don't trust anyone to be able to tell them their story, or that I will be okay, or that I am okay, right? That who I am is just fine, is good. But I see that a lot. But also with adults, that they're afraid. And with COVID did that, where where we weren't in charge of ourselves a lot. It is just really concerning. But I also think there's, being the positive person, right? I have to look at the positive things.
Sure.
I think we have a generation of youth that are really strong, and they're really smart. And hopefully they'll be able to figure out the problems, because we're not doing a very good job of it.
It seems like that is true.
Yeah.
As much as this younger generation, we're nervous about the mental health, we're nervous about social media, but they are highly educated. They're informed, in a lot of ways. So in your own practice, in seeing where Riverwoods Behavioral Health is going, do you see a new generation of mental health professionals who have a different set of capabilities or strengths that they're bringing to the industry?
I think they're more open. They're not so, there's traditional things that are really good, right? But they're more open to experimenting and using other things and looking at other ways of helping people. And I think that's really refreshing. I keep telling my therapist, you got to get out there, you got to get out, and you got to get involved in politics and different things like that, because it's really important that we continue to grow as a mental health. And we've got associations and all of us together. I think that's something that I see a little bit. Sometimes they're a little bit reserved and not wanting, and it's because they're young and they've got families, and how do
They're
you
busy.
volunteer for all those things?
Yeah,
and stuff.
absolutely.
Yeah, but I keep telling them, go, get involved, get involved.
Yeah. Well, there's so much impact to be had, and clearly mental health professionals are having a huge impact, on people's lives. I mean, it is the topic of our day. Everybody's talking about it. How to address it is an entirely different issue, but we're grateful that Riverwoods is doing what you're doing. It is a positive impact in Utah and on your clients and patients' lives. So,
Well, we hope that we are doing a good job, and we see that in the community. And the thing is my therapists love it. They love what they're doing. They love seeing people change and change quickly, because sometimes it's really discouraging if you've worked with someone for 5 years and they're not doing too much change.
right.
And ketamine is very, very different with that. But and their ability to see things in people and be positive about people. I'm really proud of my therapists. I think they do a great job.
Awesome. Thank you for lifting and making lighter, Utahns. We appreciate it.
Well, thank you.
Yeah, thanks for
and
having
thank you
us.
for all you're doing.
We're trying.
Yep.
Appreciate it.
Okay.
Thank you.